Visit elmhurst.org to explore the new City of Elmhurst website. Find out the latest Elmhurst news, pay utility bills and parking tickets, report concerns, and much more. Elmhurst.org is an ideal way to discover what Elmhurst offers your business, your family, your life.
Good morning and welcome to Community Conversations. Thank you for joining us on what I call a wonderful spring day, finally. My name is Kathy Jordan and I am the chair for the Elmhurst Senior Commission. The Commission provides information, advice, and advocacy to enhance the quality of life for older adults here in Elmhurst. The first thing I'd like to do before we start our presentation is take a few minutes to say thank you to a few people. You've probably noticed there's several handouts from ElderWorks. Carol Rasco has actually provided us with treats today, so I'd like to give her a round of applause. And I'd like to encourage you to take her book. It's just chock full of information that you can utilize, and we are probably going to have her as a speaker in the fall time. So we'd also like to thank Mayor Morley and Jim Grabowski and the city staff, because they support us and they helped set up today, and we couldn't do it without them. So I want to thank them as well. I also want to recognize our commissioners. I work with a great bunch of people. Grayson Haller is in the back. Downstairs is Jackie Haddad, Ruth Maple. In the pink over there is Georgia Dolan. She's giving us a little wave. We also have Ruth Maple, and we have Chris Hansen. We have 17 commissioners, and we make recommendations to City Hall, and we are appointed by the mayor. So, we have our hands full with trying to help seniors live their lives in dignity. I'd like to share with you that today our informative presentation is about the 2014 Medicare updates. I'd like to share a little bit about our presenter. We're so lucky to have her. Angela Benston is part of the Metro Family Services Senior Service staff and is the staff person for Elmhurst Office of Senior Services. Her office is actually located here in the City Hall. So if at any time you need any help, you can come right here to City Hall, and she's here 5 days a week. And she'll give you all that background information. Angela is a licensed clinical counselor with a master's in clinical psychology from Benedictine. She has 13 years experience with seniors in various positions throughout the country. We'd like to introduce and welcome Angela, our main speaker. We're happy to have her here today. I'm going to get my stuff out of here. Okay.
Well, good morning. First thing we're going to do is a mic check, because I want everybody to be able to hear me and hear clearly, because that's really important. Is there anyone that's having a hearing issue? Everybody can hear me okay? You can't hear me? Not very well? I think this is probably the best. Can you read my lips some? Because I don't know that we can get it any better than what it is right now. It's all low tones. I'm sorry. That's very difficult when you're having a hearing loss. Low tones don't pick up. But anyway, I'm so glad that you all came out today, and there's so many of you. That's because Medicare is so important to you. And I realize that. And a lot of the phone calls I get during the week from seniors just like yourself, or seniors that are confused about their Medicare and they don't understand. So when I was developing this presentation, I looked back over the phone calls that I have received and pulled out questions that surround those phone calls, because I found over my lifetime of working with seniors, if one senior has a question, probably 4 or 5 other seniors have a question as well. So we're going to try to address that this morning, and then like Kathy said, if you'll just hold your questions till the end, I'll stay as long as it takes to answer every question you have. and your question will be answered, and if I can't answer it, I'll point you to someone who can answer it before you leave the building. So, a little bit about Metro Family. Metropolitan Family Services has a partnership with the City of Elmhurst, and we provide the senior service staff for the Elmhurst office. And we're located downstairs on the back end of the building. Our office hours are 8 to 4, Monday through Friday. And I'm very excited that on Monday we'll be getting a new staff person here. Her name is Helen Fitzgerald. She's a licensed clinical social worker, and she'll be working with me out of that office. So there'll be 2 of us now, so that's very exciting. We are in and out of the building a lot because we work with seniors in here, and we also go to seniors' homes and work with them. So if you drop by, I might be here or I might not be here. But what I do promise you, if you call me and leave me a message, I will return that phone call within 24 hours. I try very hard to do that. But I am kind of in and out. But if you do want to see me, then call me and make an appointment. And then you know for sure that I'll be here when you show up. So let's move on to Medicare. My objectives for today's presentation on Medicare is just to do a brief overview of Medicare, what Medicare is, so that everybody's on the same page. Then we're going to talk about the 2004 premiums for Medicare and deductibles, and what is a benefit period for Medicare. That's a very confusing topic to a lot of seniors. I get a lot of phone calls about that, so I'm going to try to clear that up for you. Then we're going to talk about the hot button topic, the outpatient status versus inpatient status at the hospital versus observation. That started a couple of years ago, and it has really been very confusing, frustrating for families, frustrating for seniors. It's not clear around that. The rules written around that are really very gray, and it's very hard to understand it, so I'm going to try to do my best to clear it up for you. Then we're going to talk about your prescription drug coverage during an observation stay, because that is very different than if you were an inpatient stay. Then I want to talk about therapy caps for physical therapy, occupational therapy, and speech therapy, because a lot of you will receive those services in your home, and there are cap limits now. And then the last thing I want to talk about is durable medical equipment, because Medicare has moved to a competitive bid process for those pieces of equipment, and it's not like it used to be where you could just go to your drugstore and pick it up. Now you have to use an approved contractor. So that is a change in it as well. Okay, all the content, this is my disclaimer, all the content in this presentation came directly from the Medicare.gov website. It is not my original work. I tried very hard to use Medicare language because it's really important that you understand that language, so I took it right from there. How many of you use the computer and are online and do stuff? The Medicare website is an excellent website. You can get a lot of information from that website, and it's not real difficult to navigate. So I encourage you to go on and look at that website. If you don't, you can call Medicare, and a lot of seniors don't know this, but you can call the 1-800 Medicare number. It's 1-800-633-4227. And there's a way to get to a live body. You just say agent. And if they don't pick it up the first time, say agent again, and try to say it very plainly. And then you'll be sent to a live body. And the women and men that work the Medicare call line, hotline, have extensive training, and they can be extremely helpful to you when you're trying to figure out what's going on with your Medicare and what benefits you have. All right, characteristics of Medicare benefits, of Medicare beneficiaries, excuse me. These were some interesting facts that I pull off this website that is the Kaiser Family Foundation. They have an amazing website, and it's a lot about health care. They fund a lot of health care, and they do a lot of research on Medicare, and it's a wonderful website. The link to that website is right on the bottom of this sheet. If you ever want to pull it up and look at it, there's a healthcare newsletter that comes off that website that is extremely informative. But in 2012, over 50 million Americans are covered by Medicare and are on Medicare. Now that's seniors, but then that's also disabled individuals and widowed women and children. 50% of all Medicare recipients had an income below $22,500 a year. Yeah, whoa. That is amazing that many people live on $22,500 a year. 50% of the beneficiaries had less than $77,000 in their savings account. And that is another significant thing, because $77,000 when you are older and your body is failing you is not going to go very far. It's really not. So that's another thing to keep in mind. 40% have 3 or more chronic health conditions. And when I talk about a chronic health condition, I'm talking about COPD, congestive heart failure, kidney disease, arthritis, conditions like that you're trying to manage and move on with your life. And many, many seniors are managing 3 or more of those. 27% of the people on Medicare are in fair or poor health. So that's a significant number. And 23% have some type of cognitive or mental impairment. Because we all know the rates of dementia are increasing in our country, and many people are impacted by that. And care for someone who has some form of dementia can become very expensive. So that's another thing for you to keep in mind. All right, let's talk about Original Medicare for a minute. Original Medicare is sometimes called traditional care, and that's what Medicare used to be 20 years ago. And you still have that option to just have Original Medicare. And when you have Original Medicare, you'll have Medicare Part A, which covers your hospital. You'll have Medicare Part B, which covers your all your preventative services, your doctor's visits, the tests that you have in the hospital. Then you can decide if you want to add a prescription drug benefit, and that would be Medicare Part D. Then you also have the choice to decide if you want to buy supplemental coverage to wrap around your Medicare benefit. And it's really important that that coverage can be critical, because Medicare, even if you have A and you have B and you have D, your co-pays and your co-insurances can get extremely expensive, and that supplemental policy is going to help pick those up for you. All right, and then if you don't have traditional or original Medicare, you're going to have a Medicare Advantage plan, and that's called Part C. Sorry about that. My spring allergies are kicking in. And Part C works just like an HMO or a PPO. It's that kind of plan. It's a Medicare HMO or PPO plan. And when you have Part C, it combines Part A and Part B and your prescription drug coverage into one plan. So that many people are choosing that road now, and it can work. It can work, so it's a good option for you. You also, when you're in the Advantage plans, some of them come with prescription drug coverage, some of them don't. So you have a choice. Do I need this prescription drug coverage or do I don't? I encourage everyone to have prescription drug coverage. Prescriptions are expensive, and the longer we live, the more prescription medications we're on, and we need help paying for those. So please, always think about Part D. All right, I'm going to talk a little bit about the Medicare supplemental insurance policies, or they're called Medigap policies sometimes. These are the ones that wrap around your Medicare Part A and B when you have traditional or original Medicare. If you buy a Medicare supplement insurance, or the Medigap policy, there's like A through J plans. There's that many plans that you can choose from. And it'll help you pay your hospital co-insurance when you go into the hospital, plus it gives you an extra 365 additional lifetime reserve days. And I'm going to talk about the lifetime reserve days in a few minutes, but that's a significant number of lifetime reserve days to be added, because you only get 60. And you can, once you've done those 60 days, you're done. They're done. There will not be any more. But if you have a supplemental policy, you get that additional 365 days. Plans B through J also help pay for your hospital deductibles. If you are in a Medicare private health plan, and that would be the Medicare Advantage plans, they're called private health plans. They're the ones that work like the HMOs and the PPOs. Your hospital deductible and co-payments and benefit periods could be different from traditional original Medicare. So if you're going to choose the road of a Medicare Advantage plan, you need to sit down and think about what your chronic health conditions are, what medications you need to manage those chronic health conditions, how often you see your doctor, how frail you are, because that needs to play into what plan you choose. Excuse me, I lost my place. If your Medicare, it's really important if you don't understand your Medicare plan to call your plan provider. Every plan provider has a 1-800 number that's staffed with people on the 1-800 number, and ask questions. Ask questions to understand. And when you call, simply say, I don't understand what's going on here. Can you help me? Explain it to me. Most of them will be more than happy to explain to you what the benefit is. Now, Medicare supplemental insurance, Medigap policies, sold by private insurance companies help pay for some of the health care costs that Medicare doesn't cover. You have a one-time 6-month period when you first sign up for Medicare. And you sign up for Medicare 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. That's your open enrollment to get on to Medicare. You have a 6-month window to decide if you want to choose a Medicare supplemental policy. Now, if you're a retiree that's going to work later in life, like many of us are going to work later in life, it's very important that you work with the benefits coordinator with your company to understand how your private health care insurance is going to interface with your Medicare insurance, and if it's going to interface, because they can help you decide whether you need Part B or whether you don't need Part B. But the critical thing to remember is if you let that 6-month window go and you don't choose Part B, if you can get it back, it's going to be with a penalty, and you're going to pay that penalty the rest of your life on top of that Part B premium. So it's really important, if you're working later in life, that you work to coordinate with your benefits coordinator at your work and the Medicare. And let's see. All right, let's move on to, there we go. Medicare premiums for 2014. All right, Part A, that's your hospital insurance coverage. Most people don't pay a monthly premium for Medicare Part A hospital coverage. If you paid in to the Medicare taxes and you worked 10 years, you're covered. You don't have to have a premium for that. You won't have a premium for that. If your spouse will be covered as well if you worked the 10 years and paid into that without a premium for Part A. If you didn't, you're going to be charged a Part A premium, and those Part A premiums can be as high as $462 a month. So yeah, that's a chunk. That is a chunk of money, especially if you're on a fixed income. All right, now your Part B premium, that's your doctor's office, your test, it covers those benefits. You have a premium every month of $104.90. And most of that is taken out. A lot of people have that taken out of their Social Security check, and some don't, but a lot do. Then your Part B deductible, there's a deductible for your Part B of $147 that you have to pay every year for that deductible. All right, let's move on and let's talk about your hospital inpatient deductible. For Part A, there's a deductible of $1,216 for each benefit period. That's why it's so important that you understand the benefit period and how that benefit period works. When you're in day 1 to 60 of your benefit period, you have 0 coinsurance for each benefit period. That's days 1 through 60. You're not paying any co-insurance. When you move to day 61 through day 90, you have a $304 co-insurance that you have to pay. And when you're in day 91, you'll start moving into your 60 lifetime reserve days, and you have a co-insurance of $608 that you'll have to pay for every day that you're in the hospital. Now, if you buy the Medicare supplemental policies, or you have the Medicare Advantage plans, that will help you pay these copays. That will help you pay these copays and help you pay these deductibles. That's why it's so important that you really think about that and make a wise decision for yourself. Because if you don't have them and you just have original Medicare A and B, all these co-insurances, all these deductibles are on you. And that can run into a significant amount of money. All right, let's talk about a benefit period. A benefit period is the way that Medicare keeps track of how you're using your hospital stays and your skilled nursing stays. Your benefit period is going to start on the first day that you enter into the hospital. That's your benefit period. That's the starting of your benefit period, in the hospital or the skilled nursing facility. The benefit period ends when you haven't received inpatient care or skilled nursing care for 60 days. Now, I've had many seniors say to me, my benefit period is just 60 days. It starts on the first day I go into the hospital, and it ends on the 60th day after that. No, that's not true. Your benefit period, once you leave the hospital, and you may leave the hospital on day 10, you may leave the hospital on day 7, you may go to rehab for 2 or 3 weeks. When you finally get back home, you have to be in that home without a hospital stay or a skilled nursing stay for 60 days for that benefit period to end. So it's really important that you understand that, because let's say you're home, you've had a health event, and you're home and it's day 49 of your benefit period, and you've got to go back to the ER. A new benefit period does not start for you, so you don't have to pay the hospital inpatient deductible again, but you may be stuck paying some of these copays. And so that is, and it can run into some significant money out of pocket for you, so it's important that you understand that. Now, you can have many benefit periods. You don't just get one. You can have many. And every time a new benefit period starts, you have a new hospital deductible. You have to pay that deductible again, and then you go through the process again. So that's a real important thing that you understand. Hospital inpatient and outpatient status. How many of you have been confused by that this year? Or had it happen to you, had a loved one go into the hospital and you've been totally confused? I've had several clients who have called me just completely bewildered and overwhelmed at what to do when they got to the hospital. Your hospital status, and what your hospital status means, it's whether the hospital considers you an inpatient or an outpatient, and it affects how much you pay for everything that happens to you while you're in that hospital. That's an important thing for you to remember. The state of Illinois, there is a law where the state of Illinois doesn't have to tell you whether you're inpatient or outpatient or observation in the hospital. So you've got to ask. You have got to ask, what is my status? And you've got to be an advocate for yourself, because they may not tell you. They just may not tell you. And if you're considered an inpatient, starting the day you formally admitted to the hospital with a doctor's order. So what that means, let me say that again. Your inpatient stay starts the day the doctor writes the order and you enter the hospital. What we're seeing more and more is seniors are going to the ER, and the doctor's holding them, and he's holding them in an outpatient or an observation stay, and he's observing them to see if they need to be admitted into the hospital, which, you know, in theory is probably not, it could work. It's a good idea. It's a really good idea. Nobody wants to be there if they don't have to be there. But what's happening is they're holding you 1 to 2 days, and then they're sending you back home, and you're just as sick when you go back home as you were when you came in, and you can't get your skilled nursing benefit. So it's really important that you come to understand this inpatient, outpatient status. Time is measured by midnights when you're in the hospital. And the day you enter the hospital, and it doesn't matter, you could enter the hospital 10:30 at night. That's still day one. As long as it's before midnight, that's day one of the hospital. But while you're there, the next morning, you may wake up and they may decide, okay, well, we put you in last night, but you're looking much better, so we're going to move you to observation status today. So then that day's not going to count. And maybe the social worker is going to come by and tell you, your status has changed today. They're supposed to tell you that, but they don't have to tell you that. So it's really important to ask every morning, what am I? Am I inpatient? Am I outpatient? Just so you have a clear understanding of what's going on. The social worker, we'll talk more about that. The discharge planners, we'll talk more about that toward the end. So you need to stay 3 midnights for you to be able to go to the skilled nursing facility. The last day that you're in the hospital, the day you're discharged, is not going to count towards your 3 midnights. So you've got to be there 3 solid days under the inpatient status to get your skilled nursing benefit. And it's important that you know that. And like I said, your status can flip-flop on you while you're in the hospital. So always ask for that social worker or that discharge planner or someone from the Medicare utilization team, because they can tell you what it is. All right, hospital status and skilled nursing coverage. Medicare only covers skilled nursing if you were an inpatient with a qualifying stay. And that's Medicare terminology. That qualifying stay is going to be that 3 midnight period. Then you can go to the skilled building and you can do Medicare rehab. You count the day that you're admitted. I told you that. Observation status and outpatient status will not qualify you for a hospital stay. It's not a qualifying hospital stay. And the confusing things for many seniors is you could be held in the ER for 24 hours, or you could be put in a room in the hospital, and like you're on a floor. You're in a room, so you're thinking, I'm good, I'm in a room, I'm checked in, I'm inpatient. You could still be in a whole position, and you're considered an observation patient or an outpatient, and that's not gonna help you pay, or your Medicare benefit's not gonna pay for your skilled nursing at that time. It's gonna be all on you unless you have long-term care insurance. So that's really important that you understand that. You're considered an outpatient if you're getting emergency department services. So if you're staying in the ER and you're not getting moved, you're outpatient, but check with them just to make sure. Any kind of observation service is outpatient. Any kind of lab test, x-ray test, that's all outpatient. The doctor hasn't written an order for you yet, so you're not admitted as an inpatient. And even if you spend the night, and I can't tell you how many seniors I have this conversation with every day, I spent the night in the hospital, so I'm inpatient. No, you may not be. You really may not be. You're just in that room and you're sleeping there, but you're outpatient. And the nurse may be coming in, she may be taking your vital signs, you're going to be receiving medications, but you're still outpatient. All right, observation services. Hold on, I think I just went over that. What you pay, this is a really important one. What you pay if you're inpatient status. Medicare Part A covers hospital insurance. If you're an inpatient, your Medicare Part A benefit is going to pick that, is going to help pay for that. You're going to pay the deductible, which is $1,216. And that's going to kick in. Your Medicare Part B is going to kick in, and it's going to cover most of the cost for the doctors to come and see you, the lab work that's done, the x-rays, all that's going to be covered under there. And you'll have to pay your Medicare Part B deductible, which is $146, I think. That's wrong, that $104, it should be $146. What do you pay if you're an outpatient? So listen carefully to this, because this is significantly different if you're an outpatient, what you're going to pay at the hospital. Your Medicare Part A is not going to pay anything. If you're outpatient or observation, it will not pay a dime on your hospital bill. So then it's going to switch to your Medicare Part B. And Medicare Part B is going to cover the doctor's services. It's going to cover the lab tests that are done. It's going to cover the x-rays that are done. It's going to cover any of the testing that is done to you while you're in the hospital as an outpatient. However, there's going to be co-payments and deductibles associated with every service that comes to you. And that's really important that you understand that when you're an outpatient and you're in the hospital. They say that the total co-payment for all your outpatient services while you're in the hospital, and this gets into that gray area that I like to talk about with Medicare, cannot be more than your Part A deductible, which is $1,216. So any one deductible that they charge you cannot be more than $1,216. However, they are going to charge you a deductible for every service that's done for you. And when you add all those deductibles up, you may be over that $1,216. And then you're still going to have co-payments that you have to make toward that. And that can run into a significant out-of-pocket money for you. It really can. Paying for medications during an outpatient stay, this is so confusing to many, many, many seniors. Generally, prescription drugs and over-the-counter drugs you get in an inpatient setting, in an outpatient setting in the emergency department. They're sometimes called self-administered drugs. They are not covered by your Part B. They're not. So if you are in the emergency room and you need a pain reliever, and you're in an outpatient basis or an observation stay, you're going to get charged whatever cost the hospital attaches to that pill that they bring to you. And it's not going to be $1. And it's going to be a significant amount of money, and that can add up. If you need something like Mylanta or some other kind of antacid, they're not going to pay for that either, and you're going to get the hospital charge, whatever the hospital's charging for that. So it is a significant amount of money. Many hospitals, for safety reasons and for liability reasons, will not let you bring your own medication in. They don't want you to do that. They don't allow it. Therefore, any maintenance medication that you are taking when you go to the hospital, it's going to have to given to you from the hospital pharmacy. So then you're going to have, that's not going to be a reasonable amount of money. It can be a significant amount of money when that happens. Many of the hospital pharmacies do not participate with the Medicare Part D prescription drug. They're not a provider. They're not called in-network. So any medication, let's say you're an asthmatic and you're taking inhalers, or you're diabetic and your diabetic might be covered, but an asthmatic taking inhalers, you're going to have to get a new inhaler, and you're going to have to get a new inhaler from the pharmacy at the hospital, and it's going to be considered out of network. And then you're going to have you're going to have to pay for it out of pocket first, and then you're going to have to turn a reimbursement into your insurance to see if they'll reimburse you for that payment. And almost any senior I've worked with, they've never reimbursed them for the whole amount. They've considered a portion of it, but not the whole amount. And so you're likely going to have to pay out of pocket, and it can be tough. One thing you need to do is, when you're in the emergency room, is save all your receipts, save everything. And save your hospital bill that shows what medications were given to you, because every hospital bill will outline all the services that were provided for you and all the medications that you received. And you can use that to attach with your paperwork to turn into your insurance company. But please make sure you make copies of everything you send to your insurance company. And if you don't have a copier, call me and come to my office and I will make your copies. It's really important that you keep these copies, because things fall through the crack, and you want to be able to prove when they say they didn't get it that you sent it. Look for instructions in your Medicare drug plans enrollment forms on how to submit an out-of-network claim. Because if you're in the hospital and you're receiving medications as an outpatient or observation, all of those drugs are going to have to submitted as out of network. So when you've got some time, when it's a rainy day or something, pull out that drug coverage plan you have and look at how you go about doing that. And if you don't understand it, pick up the phone and call, so that when you're in an emergency situation and you're in the hospital, you know what's going on and you're not having to figure it out then, because it's not fun when that happens to you. And you can always call Medicare, too, and ask them how this works, and they'll help you walk through it. What should you know about Medicare Drug Plan Part D and self-administered drugs? Usually, your Medicare drug plan only covers prescription drugs and won't pay for the over-the-counter, like I just said. Any drug you need needs to be on your Medicare formulary, and that's another thing that's very confusing to people. All your plans have formularies, and then the formulary uses that to decide how they're going to pay for your medications. All right, if you're in the hospital, probably all the maintenance medications you're going to take are on your formulary. Odds are they're on your formulary, but what if they decide to add a new medication? It may not be on your formulary. And then you're going to have to pay the whole entire cost of the price of that drug. And that can be significantly expensive. Now, I did have one of my clients that happened to. She called her drug company, and they did put that medication on her formulary. And then she resubmitted the bill, and they did reimburse her for that. So always, if that happens to you, make the phone call to your Medicare Part D prescription drug plan. Your Medicare drug plan will check to see if you received self-administered drugs from an in-network pharmacy, which I think this is the most ridiculous thing. You are in a hospital. How are you going to go to a network pharmacy when the hospital pharmacy's probably not in network to get your medications when you're in the hospital? And even if your spouse goes and gets your medications, they can't bring them back into the hospital for you because the hospital doesn't allow it. So that's another one of those great things about your Medicare. And remember, most hospitals do not participate in Part D. They just don't. All right, here's some good news, I guess you can say. The Center for Medicare Advocacy has this wonderful packet online, and I put the website down on there, where it will walk you through, step by step, how to challenge an observation stay or an outpatient stay. And it's very clear. I've read it. It's very easy to follow. And that is the link. You put that into your browser, it's going to take you directly to that packet. And if you need that information and you cannot get it to work at home, give us a call. We'll be happy to download it for you. I can either drop it in the mail to you or you can come by and pick it up. Now, the Senior Health Insurance Program, have any of you used SHIP or SHIP counselors to help you? Oh, SHIP counselors are marvelous. You guys need to use them. They're trained by the Insurance Department of the state of Illinois, and they're trained in all the Medicare options. They know all the supplemental policies. They know the Medicare Advantage Plan policies, and they can sit down with you. They can look at who you are as a person and help you fit what Medicare is going to work best for you. So I encourage you to use SHIP. And I'm trying to work with Amy Schraell at the Park District to get some SHIP counselors here this fall so that seniors can call and make appointments and go in to see them. I know there's a few scattered throughout Elmhurst, but I think it would be helpful. I'll get you at the end, I promise. I'll come back to you. If there was a designated place where the SHIP counselors could be and people could make appointments, I think you'd use them more. Then there's also an organization through Medicare called a Quality Improvement Organization. And we have one that covers Illinois and Iowa. This is the phone number back here to get to this Quality Improvement Organization. If you've been in the hospital and you were considered an outpatient and you feel strongly you should have been inpatient, call this number. What you'll get is a voicemail. You'll leave your name and just a brief statement about what happened to you. They will call you back, and they will take a really in-depth interview with you. It'll take an hour or so on the phone, but they can help you get this changed or reversed or moved to inpatient status. And it's a wonderful group to work with. They're very patient, they're very knowledgeable. I've had two of my clients use them with great success. So keep that number tucked away somewhere. All right, let's talk a little bit about speech therapy, occupational therapy, and speech languages, and physical therapy. These services are covered under your Part B. The services are only covered if they're medically necessary, so you got to have a need for the service. There are therapy caps now on these services, and these are how the caps work. It's $1,920 for your physical therapy and your speech language services combined. So you've got $1,920 for both speech and physical therapy. And a lot of seniors who are recovering from stroke are going to use speech and physical therapy. So that's what you have for that cap. And then for your occupational therapy, and occupational therapy is more about helping you regain your ability to move about your home and take care of your ADLs. That has a separate $1,920 deductible. The good news, there we go. The good news with these deductibles is you can ask for an exception. So there is an exception. Your therapist has to document and provide to Medicare that this is a medically reasonable and necessary service for you to continue. And if they do that, Medicare tends to improve them if the documentation is right. And it needs to indicate on your Medicare claim for service that above the therapy cap, that your outpatient therapies are medically necessary. And they have to, it's up to your OT, your PT, that clinic to turn this paperwork into Medicare. Then a Medicare contractor will review your medical records and check for medical necessity and see if you'll get approved for the cap. If you're approved for the extension, it'll go up to $3,700 for PT and speech combined, and then $3,700 for for occupational therapy. In general, your therapist provides documentation that your services were medically reasonable and necessary, and you won't have to pay the cost above the $1,902. You do have co-pays associated, I think, with the therapy, but they're not too bad. Now, this is something to keep in mind. This is extremely important. If the additional services are not going to be extended, your clinic, your physical therapist, your occupational therapist, your speech person needs to give you an advanced beneficiary notice of non-coverage. That's an ABN for short. That's what they call it. They must give you a written notice telling you that the services are not going to be provided and they're not deemed medically necessary. So you have to have that. And if they don't give you that and they extend your service, I think there's some clause in there you don't have to pay for it if you haven't received that ABN. So it's really important, and I coach seniors all the time. When you're doing outpatient therapy, physical therapy, occupational therapy, just routinely ask them, where am I in my therapy cap limit? Where am I right now? How much more? How many more do I have? Do you think we're going to be able to file for an extension where I can get more services? Just so you're on the same page with them and there are no surprises. Medicare will not pay for services that are not medically reasonable or necessary. And so that is a phrase you just need to remember. They will not. And the ABN lets you choose if you want to continue the service, but also understand if you want more speech therapy or occupational therapy and it's not covered, it's going to be on you. It's going to be out of your pocket. So just as long as you understand that. If you get therapy services that aren't medically reasonable or necessary and Medicare doesn't pay for them, you won't have to pay if you did not receive that ABN. So that's really important to know. If you didn't get that ABN, you won't have to pay if they extend it. But if they give you the ABN and you choose to extend it, then it's on you. let's see. All right, durable medical equipment. In January of 2011, Medicare started a competitive bid process for certain durable medical prosthetics, orthotics, and supplies in different regions around the country. The Chicagoland area was Region 2, and it got rolled out in 2011. And this program is in effect in our area, and in January of 2014, Medicare signed new contracts with new vendors to be a supplier of durable medical equipment. All right, I wanted to make sure you understood what durable medical equipment is. So I'm not going to read through all of these, but it's broken down into categories. And these are the things that Medicare has deemed durable medical equipment and that your Medicare benefit will cover and will help pay for. But the important thing that you need to understand, you have got to use a Medicare contractor. The easiest way to find out who the Medicare contractor is to go to the Medicare website. It's medicare.gov. And then you can put in Medicare contractor, and then a screen will pop up. And you put in your zip code. You just put in the zip code for Elmhurst. Then you click on it. Another screen pops up, and then you go down and look at and it's really laid out very well for you. You choose the piece of medical equipment that you need. Say it's a walker. You click on it, and then you hit search. A whole list of approved vendors in the Elmhurst area will come up, and it'll go out about 20 miles. And so all of these vendors that are on this list have been approved to take assignment for Medicare. So what that means is you're going to order your walker, and you're going to go there to pick it up, and Medicare has set a dollar value on that walker. So that vendor is not going to charge more than that dollar value on that walker, and that vendor will only charge you a copay if you have a copay associated with that walker. It won't charge you any more. So it's a way for Medicare to kind of control cost, but it's really important that you understand you've got to use the contractors that are in the Medicare system. And there was a lot of uproar when this rolled out because not everyone got chosen, not everyone wanted to take assignment for Medicare. So maybe someone that you've been using for many years to do things, your pharmacy, maybe they're not a vendor now. So unless they were grandfathered in to being a Medicare contractor, you're not going to be able to use them and get your Medicare benefit to pay for it. You can use them, but you're going to pay a significant amount of money out of pocket. All right. What are your rights? And this is straight from the website, from the Medicare website. No matter what type of Medicare coverage you have, whether it's original Medicare or one of the Advantage plans, you have certain guaranteed rights as a person with Medicare. You have the right to have your questions about Medicare answered, to learn about your treatment choices and participate in your treatment decisions, get a decision about health care payment or services or prescription drug coverage, get a review or an appeal of certain decisions about the health care that you, like inpatient versus outpatient, file complaints, sometimes called grievances, including complaints about the quality of service. And this is the number for Medicare down here where you can call and ask these questions and get these questions answered. But what I always encourage people, if you don't use your voice and you don't make the phone call, no one's going to do it for you. They're just not. So it's up to you. And you have to learn to be your own advocate when you're in the hospital and speak up for yourself. And use your own voice while you're in there to get your questions answered and your questions heard. Hospitals are busy places. Staff is really busy. But you have a right to have your questions answered. And if your questions aren't being answered in the hospital, ask for the Medicare Utilization Officer. Every hospital has a Medicare utilization team. And they will come and they will answer your questions because by law they have to answer your questions. So that's a really good thing to know. Where can I get more help? If you need help understanding your hospital status, speak to your doctor first. Ask your doctor. Ask your doctor, because your doctor is truly the one who's driving your status. He is the one that makes the decision you're inpatient or you're outpatient. or someone from the hospital utilization team, or the discharge planners, the social workers. They will be able to tell you too. To ask questions or report complaints about the quality of your care, like I said earlier, call the QIO, and there's the phone number to get answers. Health insurance counseling, that's the SHIP I was talking about just a few minutes ago. I want to just go back and touch on that again. This is the address for SHIP. It's the address for down in Springfield where you can find out. They'll let you know who in the Elmhurst area is a SHIP counselor. That is a free service. It is a free service to you, and it is a trained person that will sit with you and help you figure out this big old gray mass that's Medicare. And what a gift that is. So use these people. They're trained, they volunteer your time, it won't cost you a dime, and it can be the best service ever. It can give you peace of mind. And here's the Medicare website. And there's like 107 different publications about your Medicare on this website. If you just click on publications, many of them are 5 to 6 pages long and very informative. If you've got questions, go on there and search for one. Odds are it's going to be on there, and there'll be it'll give you some frame of reference. And thank you. That was a lot of information.
Let's give Angela another round of applause. She did an excellent job. To let you know, she's right here in the building, and she comes to our commission meetings every month, and she is just a godsend. That's why we felt it was so important to have her here, and she has many other resources that she can share with you. But that's where some of your tax dollars are going, because they help subsidize Metropolitan Family Services. So we are very fortunate that the mayor and city council feel that seniors are important. One of the things I would like to share with you is this is the last community conversation of the year. We will be coming back in September, and we hope that you join us. We'll have 3 other presentations. One, I believe, is going to be ElderWorks. We were talking with Carol Rosso, who actually, as I shared with you, she has a resource book out there, and I think they're all gone. I apologize if I'm telling everyone to take that book. There's also Pocket Pals out there. That's something that our commission has provided, and it's chock full of information, and we're going to actually be revisiting that and updating it. So we'd like you to also take that and keep that with you for a resource. I always like to leave everybody with a little inspiration, for the day. So, life is a gift. Never forget to enjoy it and bask in every moment that you are in it. Today is a beautiful spring day. Please make it a good day. Thank you for coming to Community Conversations.
Have you visited the Elmhurst Public Library lately? The Kids Library is a wonderful place, especially with our many exciting children's programs. The second floor is home to the adult and teen collections. From research to magazines, we've got it. We have more than 80 computers throughout the building. or bring your own laptop. The entire building has wireless access. Need a quiet place to study? Try our silent study rooms. Book one of our spacious meeting rooms for your group. Our convenient book drop and drive-up window make picking up and returning library materials a breeze. And don't forget, EPL is open 24/7 online at elmhurstpubliclibrary.org.